Good morning, guys. Last time we were visiting and talking about the uniqueness of chiropractic. I want to take it to the next level, okay? And so first, let's just start with some basics. Again, this is what a normal neck would look like. This is the front, this is the back, and there's a curve in it. We have equal space between the occiput and atlas and C2, and then we have these nice healthy looking squares we call vertebra, and equal spaces in between each of those vertebrae. Okay, and then as stress or injury occur, then we end up with a loss of the normal curve. We end up with development, right? Here's healthy looking joint space, until we get here. You'll notice this distance between vertebra above and below. You'll notice the thinning of the disc and the reshaping of the bone. This is bone spur development, degenerative joint and disc disease, if you will. And then this ultimately will progress to this. And that is, if this is uncorrected, then we have severe loss of normal curve. We have severe development of bone spur. We have severe degenerative joint and disc disease. In other words, the discs are drying up and breaking down, disc desiccation. Okay? And so we talked about that. Now that's a process. Okay, that has been going on over time, many years, and you've been adapting. Patient one comes in, he's like this, and he says, I've been adapting, right? My neck doesn't bother me. It doesn't hurt. I can't, maybe sometimes it's stiff. I don't turn it as good. I'm not as flexible as I used to be. I don't really have a problem but when you take an x-ray, you find it, right? It's like going to the dentist. You don't know you have a cavity. He takes an x-ray and goes, you have a cavity right here. Now, my question to you is, when do you want to take care of it? You want to take care of the cavity before it hurts or after it hurts, right? Which one's less expensive, right? Same thing with your spine. And the reason you don't feel this is because your body's been adapting. It's been compensating for this. The muscles, the ligaments, the tendons, all compensating. You come in, next time I see you, you come back 10 years later, and we take another film and I see this. And now when I ask you questions, you go, I can't turn my head as good. My neck is sore. I have pain and knots in my shoulders. I'm dropping things. I can't button my shirt, right? The body's been adapting as long as it can until it can adapt no more. And then the pain shows up, and then here you are, okay? So as a chiropractor, again, my job is to restore motion to those joints, okay? That's my job. If I restore the normal motion to these fixated joints, these joints that have been injured, then the body will start to heal and begin to adapt to its new normal, okay? Now, you come in and you say, well, I got a little stiff neck, so I popped a pill. I've got a little headache, so I popped a pill. Did a pill fix the way that joint moves? No. Therefore, it didn't correct the adaptations that your body's been making along the way. So you come in and you say, Doc, I've had some neck pain and injury. I'm not able to turn my head. I can't back up to see when I'm driving, for example. If I turn my head this way, I get pain. If I turn my head this way, I get dizzy, right? Those adaptations, I'm not good. And so you say, well, what did you do? Well, I've taken some pills. It's not helping. It might cover the pain and symptom for a little bit, but, it's not fixing the adaptation. Well, what else did you do? I went to physical therapy, so they tried to correct the adaptation without correcting the structure. See, we skipped a step. We didn't correct the structure, and therefore, my muscles are stronger, but now they're stronger with this. They didn't fix this. And so the physical therapy seemed to work while I was doing it, but the problem is back. As soon as I stopped the physical therapy, 3, 4, 5, 6 months later, the problem is back. Only this time worse, right? And of course, surgery, we say, well, we went to surgery and they fused this together. So now the adaptations are permanent. This is what you're stuck with. Because when we fuse that together, what do? They put screws in here and hold that together. Okay, but chiropractic is unique because we come in and our goal is to restore the motion to these injured joints and keep it that way long enough for your body to continue to adapt back to its new normal or back to its original set normal. Okay? Until we get these joints moving properly, physical therapy it will be less effective, right? Surgeries make it much, much more difficult, and medications only cover the pain. If you knew what I knew, you would do what I do. And again, I'm Dr. Alan Levy at C1 Family Chiropractic.